Hello, my name is Genesis Curiel, and I will be talking about CPT and HCPCS coding, better known as HCPCS coding. To start off, we're going to talk about the history of CPT codes. What is CPT? CPT stands for Current Procedural Terminology. CPT code set is medical code developed to communicate about services rendered to the appropriate medical channels for reimbursement. CPT was developed in 1966 by the American Medical Association and published several editions. Published the first edition of CPT, which at the time focused on surgical procedures. The first edition sought to standardize terminology and reporting. The second edition in 1970 expanded CPT scope. In 1983, the Healthcare Financing Administration, HCFA, now CMS, adopted CPT for reporting of physician services of Medicare Part B benefits. In 1987, HCFA also adopted CPT for reporting outpatient surgical procedure. Now let's talk about the history of HCPCS coding, or HCPCS codes. What is HCPCS? HCPCS stands for the Healthcare Common Procedure Coding System. HCPCS is a standardized coding system to process claims for insurance payments by the Center of Medicare and Medicaid Services. HCPCS was developed in 1978 by the Center of Medicare and Medicaid and consists of 3 levels. Level 1 was introduced by the CPT and is identical to CPT coding. It is used for inpatient or office visits where the treatment or supplies is used in the medical facility. Level 2 are designed to represent non-physician services such as ambulance rides, wheelchairs, walkers, durable medical equipment, and other medical services that don't fit readily into Level 1 or CPT codes. Level 3 codes are used for local coding when the procedures or services is not listed within the other 2 levels. So, talking about CPT and the HCPCS codes, let's talk about ones that the DPT codes uses. They use therapeutic exercises, neuromuscular education, aquatic therapy, gait training, manual therapy, group therapy, therapeutic activity. So CPT introduced 3 new codes. So I'm going to go into depth about these 3 new codes. The first one is low complexity evaluation. It takes place when the patient is stable and exhibits uncomplicated characteristics. For example, a patient may have suffered a grade 1 ankle sprain and experiencing some pain and swelling. However, the symptoms can be predicted and the therapist can anticipate a full recovery. This constitutes as a low complexity evaluation. The second new code is the moderate complexity evaluation. When a patient condition has changed characteristics and an evolving clinical presentation, and here's an example, a patient who had surgery to repair a fracture, it's been 8 weeks since the surgery, and the fracture isn't healing as expected, delayed healing, this can be considered a moderate complexity evaluation. The third new code is high complexity evaluation. When a patient is unstable and has unpredictable characteristics, for example, a patient may be an adolescent with cerebral palsy that's prone to mood swings, has a low IQ and extreme difficulty maintaining attention. If you were to perform an evaluation on this patient, it would be considered a high complexity evaluation. So we've talked about the codings, and now let's talk about how all these codings intertwine with the microeconomics of coding impacts physical therapy. CPT coding requires extra work time to report billing codes, as well as the institution verifying the correct billing. Choose the correct code for the procedure, is it manual therapy or massage. It also limits with reimbursement. Example, maximum 4 units may be billed per date of service, maximum PT coverage of $3,500 a year, but that can vary. There's also the restriction on who may perform the procedure. For example, a PT or PTA may administer the HCPCS DME, durable medical equipment, or may perform the education of the DME according to the contracts with insurance companies. So that was the microeconomics. Now the macroeconomics of CPT and HCPCS codes. The government requires extra resources and time to track billing and ensure facilities and providers are properly utilizing medical resources and services. It decreases overbilling through accountability, which saves medical resources and ensures proper services that are administered. It allows for tracking all medical resources from services to tools utilized in the medical community. allowing the government to ascertain what is normal for any given services. The government can manage and reimbursement for inefficient or inappropriate billing. Also allows them to track the overall quantity of medical resources and services utilized at any given period. So in summary, physicians rely upon CPT and HCPC codes to report services for payment. The CPT and HCPCS have evolved since the introduction, and the AMA has a specific process for monitoring the integrity of CPT and adapting for changes in physician practices and medical technology. The AMA rules are specific, and over a long run, physicians and their patients will be best served by the following recommendations of CPT and HCPCS coding. Any questions? And these are my references. Thank you.